Did you wet in bed? Did you go motion in public? Elimination disorders. Myself Sukumiii. I am the student of occupational therapy. Elimination disorders, Enuresis and Encopresis. The child after 5 age or on 5 age, they may wet. That is called Enuresis. They wet their bed by passing urine. If they go motion in public without control, then that is called Encopresis. That is also after age 5 or on age 5. In these two disorders, they eliminating one urine or motion. So that is called elimination disorders. For this, achieving continence means to control is the main goal of treatment. Okay, let's discuss about Enuresis is a urological disorder. It happens in childhood. More commonly, males are affected than females. The ratio is 1.4:1. The prevalence decreases with increasing age. The age 10, there is low prevalence for the enuresis. If the age is 5, there is more prevalence for the enuresis is classified into two types: primary enuresis and secondary enuresis. In primary enuresis, the children have never have the urinary control, so they wait all the day. That like in secondary, they have control for some time. After that, they have lost control. That is secondary enuresis. In primary, they never have control. In secondary, they have control and they lost again. It is furtherly divided into two types: nocturnal and diurnal. Nocturnal means during sleep time they urinate. Now, during daytime they are urinating, that is called diurnal. Who are all having risk factors genetic in their gene, they have these like disorder, then they have chances to get that. And in family history or with the twin, so twin brother has that problem, then this brother also have going to be get this problem due to idiopathic causes, which means unknown. So unknowingly some members are urinating due to overactive bladder, which means the children drink more water and the bladder is overly active. That also cause some voiding problem and it results in the enuresis. UTI problem, diabetes insipidus or else constipation also leads to get the primary enuresis. Secondary enuresis, psychological problem or any seizure due to any urethral obstruction, the secondary enuresis may happen. Okay. For normal child in age 4, they have a very good continence, which means they have very good control for the urinating. Due to overactive bladder, which means I already said they may have polyuria. So they have increased volume of water that increase the urinating. So it may damage the antidiuretic hormone and it results in the enuresis. Some person has arousal impairment, which means during sleep they have a sensation and they should wake. So if they don't wake, then it is called the arousal impairment. Then they pass urine in the bed. In our pons, mixation center is present, which means in brainstem, pons is there. In pons, mixation center is there. So if there is a problem in this pons, the mixation center, it also cause enuresis. To identify the problem, clinical feature, we have to take many histories. In HX is denoted for the history: hydration history, nutrition history, developmental history, toilet training history, sleep history, and the history of any other possibility is causes. So history of cause and the history of voiding pattern, how frequency, timing. So these histories should be taken. And physical examination, abdominal examination, which means by ultrasonography something. So size of the kidneys and any stool mass is present in the abdominal area, that are all noted. Then neuro examination, the sphincter muscles are present, right? So the power, the reflexes, the sensation or neurological examination. Due to spine defect, they may have the incontinence problem, so we have to check for the spine examination. How we diagnose urinalysis? So it is a test used to diagnose the enuresis and voiding test. So how they voiding, frequency, timing are noted. So to diagnose it as a enuresis, they should voiding 3 months. Each 3 months, in each week they have voiding at least 2 days. Okay, at least twice. So twice a week for 3 months is a diagnostic criteria. These significantly affect their academic or any social or emotional response, and these cannot be attributed by the physical medicines. So they give medications that is not reduce the symptom. The behavior is continuous. For example, the person have constipation, give constipation medicines, but they continue the behavior after taking the tablets. So the voiding behavior is still present after treating the constipation. What are all the treatment? Counseling, educating, behavioral modifications, and more effective therapy, alarm therapy. If the person start mastering, the alarm is vibrating, so the person waked. This enuresis has spontaneous cure without treatment also. The person has no mortality, which means the person no going to be died. After therapy, they have improvement of self-esteem. Some person have also relapse, which means again showing the symptoms after treatment. Okay, this is all about enuresis. Next, encopresis, bowel control. So if the person has lost their bowel control, then the person defecate in public or in any place involuntarily. Encopresis has classification primary and secondary. In primary, continuous, so which means the symptoms shows continuously. In secondary, they have sometimes control but sometimes uncontrolled. So incontinuous. What are the causes is classified into two factors: physiological factors and the psychological factors. Okay. First, chronic constipation. The child having chronic constipation for some weeks may result in the encopresis. Avoidance of defecations. So the person have to defecate but they avoid, or they having infrequent, so not proper defecation. It also leads to the encopresis. Withholding the bowel movement, they control their bowel movement, that also leads to encopresis. The person has sphincter problem, so external and internal sphincter problem has also leads to the encopresis. The parents giving more punishment, harsh, that psychological factors also leads to encopresis. What happens in chronic constipation? The chronic constipation enlarges the rectum, which means rectal distension happening, so it stretches the both internal and external sphincters. This result in incontinence. What are the investigation? Abdominal X-ray. Is there any constipation or stool material is present inside? That are all noted. Rectal biopsy, anorectal manometry are used to investigate. For diagnostic criteria, the person have at least 3 months. So once a month they have this problem. So once a month they have uncontrolled motion. So that is once a month for at least 3 months. Then the person have the encopresis. So the children have at least 4 years. 4 years or above. They have this problem. Then they have encopresis. What are the treatment? If the person have any disturbed material in their colon, which means large intestine, colonic disimpaction, the unnecessary materials are taken back, and demystification, which means breaking the mysteries, and education are provided to the children. Routine laxative therapy are given, and their behavior modification are provided. After that, follow up, which means after treatment they have want some care, so we have to give the follow up care. The person with encopresis has many psychological problems. We have to focus on these also. Okay guys, today we are discussing about eliminational disorders. Thanks for watching. Be proud to watch our video. Tata.